Hello friends and dear students, welcome back to my YouTube channel SS Pediatrics. Today I am here with another topic, that is hearing loss. Hearing loss is also known as deafness and hearing impairment. So today I will discuss regarding this. So before understanding the concept of hearing loss and hearing impairment, we have to know what is the mechanism of hearing, how the hearing process. So hearing is the transduction of the sound to the neural impulses and its interpretation to the central nervous system. And hearing impairment and hearing loss is somewhere when there is some interference in between the transduction towards the interpretation of the sound by the central nervous system. So in today's lecture I will discuss with you regarding the various types of hearing loss or hearing impairment, and you can also say as the deafness. So इसके types के regarding मैं आज आपको बताऊंगी. So let's start with the topic, types of the hearing loss. Start with the topic, types of hearing loss. Definition of hearing. Hearing means transduction of sound to neural impulses and its interpretation by the central nervous system. Hearing loss, defect of any level from the sound transduction to the interpretation. If there is any defect in between from the transduction of the sound towards neural impulses and its interpretation by the central nervous system, then that leads to the hearing loss. Next is the types. First is conductive hearing loss. Second is sensorineural hearing loss. Then mixed hearing loss, and in others it includes central hearing loss and functional hearing loss. Start with the conductive hearing loss. As the name indicating means, conductive means conduction. So there is a problem in the conduction. So conductive hearing loss is any interference with the conduction of the sound impulses through the external auditory canal, the eardrum or the middle ear. Later on this sound is used to travel through the neural impulses and its interpretation by the central nervous system. But in this conductive hearing loss, the problem in the conduction of the sound impulses by the external ear. Conductive hearing loss can be caused by anything that interfere with the ability of the sound waves to reach the inner ear, such as cerumen, foreign bodies and infection. Next is sensorineural hearing loss. Originates in the cochlea and involves the hair cells and nerve endings because it includes the neural impulses part and sensory neural parts. So hearing loss results from the disease or the trauma to the sensory or neural components of the inner ear. And in case of mixed hearing loss, occurs when an individual has both conductive and sensorineural hearing loss. This can be caused by a combination of any of the disorders. And in case of central hearing loss, it occurs when the central nervous system cannot interpret the normal auditory signals. As I told you in the definition, that hearing is the transduction of the sound to the neural impulses and its interpretation by the central nervous system. But if there is a problem in the interpretation of the sound by the central nervous system of an individual, then that leads to the central hearing loss. This condition occurs with such disorders as cerebrovascular accidents and tumors. Next is the functional hearing loss. Functional hearing loss is a hearing loss for which no organic cause or lesion can be found. Also called psychogenic hearing loss and precipitated by any emotional stress. And malingering is a type of psychogenic hearing loss, and in malingering there is no organic or psychological cause. The patient is pretending to be deaf for personal gains. Next is the severity of hearing loss. This is the loss in decibels. When a person is to be identified how much the person is having a hearing impairment, then that level of hearing loss is to be calculated in the form of decibels, so that which is the unit of sound waves. So here is the 0 to 15 and more than 15 to 25, more than 25 to 40. So if there is a 0 to 15 decibel, then it is a normal hearing, and if it is more than 15 to 25, then there is a slight hearing loss, and then it leads to mild hearing loss, moderate to severe hearing loss and profound hearing loss if the loss in the decibel is more than 90. So this is all about my today's topic, the types of hearing loss. I hope you all were clear with the types of the hearing loss, and if you want to know more regarding this hearing loss topic, causes, diagnostic measures for the hearing loss, and prevention for this hearing loss, management and nursing management for this, then you have to listen to my further videos. So thank you for watching my video, and please like and share my videos. Thank you.